Now let's talk about organ relationships. Liver and kidney, spleen and kidney. The liver and the kidney. The key points, the physiological relationships. Essence and blood originate from the same source. Interdependence of storage and discharge. The liver yin and the kidney yin nourishes each other. The relationships between liver and kidney are mainly marked by mutual transformation between essence and blood, interdependence of storage and discharge, and mutual generation of yin essence. Physiologically, essence and blood come from the same source. The liver stores blood and the kidney stores essence. Both blood and essence come from the food essence transformed and transported by the spleen and the stomach. Sufficient blood in the liver makes it possible for the kidney to store essence, and abundant kidney essence provides necessary nourishment for the liver. That is why the liver and kidney share the same origin, and yi and gui share the same origin. The other is the interdependence of storage and discharge. The liver governs free flow of qi, while the kidney dominates storage. Both are opposite and yet complementary to each other. The discharge of liver affects the function of the kidney, while the storage of kidney can prevent over-discharge of the liver qi. The two aspects support each other to coordinate the functions of menstruation and ejaculation. In addition, the liver yin and the kidney yin nourish each other. Kidney yin is the root source of every yin organ. Thus, the relationship between the kidney and liver is mother-son according to theory of the 5 elements. Therefore, liver yin and kidney yin invigorate each other so as to restrict liver yang to maintain balance of yin yang between kidney and liver. Pathologically, deficiency of kidney essence may lead to insufficiency of liver blood, while insufficiency of liver blood can cause deficiency of kidney essence. It eventually results in symptoms such as dizziness, tinnitus, deafness, lower back soreness, and lower sexual function. If the discharge of the liver and storage of the kidney are not in harmony, there may appear disorders of irregular menstruation, impotence, spectorrhea, or erectile dysfunction. If the kidney yin is insufficient, it may lead to deficiency of liver yin and hyperactivity of liver yang, resulting in symptoms like dizziness, irritability, dry eyes, and lower back soreness. Now, the spleen and the kidney. Key points, the physiological relationships. Prenatal versus postnatal. The spleen is the root of the postnatal essence, and the kidney is the root of the prenatal essence. Fluid metabolism. The spleen governs the transportation and transformation of the water, while the kidney governs water metabolism. The relationship between spleen and kidney are essentially reflected by the mutual promotion of prenatal and postnatal essence, as well as their cooperation in water metabolism. The spleen is the root of prenatal essence, and the kidney the root of postnatal essence. The transforming and transporting functions of the spleen qi depend on the steaming function of the kidney yang. The abundance of essence qi in the kidney also depend on the nourishment of the postnatal essence by the spleen. The spleen and kidney promote each other, which is vital to life activities. The warming and qi transforming functions of kidney yang are helpful to transform and transport water of spleen. Both organs coordinate with each other in the process of water metabolism. Pathologically, spleen and kidney, prenatal and postnatal essence affects each other, which can cause the syndrome of Yang deficiency of both spleen and kidney, with the manifestations of coldness and pain in the abdomen, diarrhea with undigested food, and edema. Thank you for your attention.
We discuss interviewing a patient who complained of feeling of distension of the eyes. A feeling of distension of the eyes is often associated with emotional problems affecting the liver, causing liver qi stagnation and liver fire. Pronounced feeling of distension of the eye that causes liver fire would have pain in the eye, bloodshot eyes, dry eyes, headache, red face, dizziness, tinnitus, irritability, propensity to outbursts of anger, thirst, bitter taste, constipation, dark urine, red tongue with redder sides and dry yellow coating, wiry, rapid pulse. For liver yang rising, the feeling of distension of the eye will be accompanied by headache, dizziness, tinnitus, irritability, propensity to outbursts of anger, and the pulse will be wiry. For feeling of distension of the eye caused by liver wind, there will be tremors, severe dizziness, tinnitus, headache, tics, convulsions, rigidity of the neck, tremor of limbs, stiff neck, opposites of tonus. In severe cases, coma, stiff, moving, or deviated tongue, wiry pulse. Phlegm obstructing the lungs and spleen that is a cause of feeling of distension of the eye. The patient will also have enlarged pupil, chronic cough that comes in bouts with a profuse white sticky sputum that is easy to expectorate, white pasty complexion, a feeling of oppression in the chest and epigastrium, shortness of breath, wheezing, nausea, epigastric fullness, swollen tongue with a sticky white coating, slippery pulse. Liver and kidney yin deficiency with empty heat that would cause slight feeling of distension of the eye. The patient would complain of blurred vision, dry eyes, feeling of heat in the eyes, dizziness, tinnitus, hardness of hearing, dull occipital or vertical headache, insomnia, numbness or tingling of the limbs, malar flush, lower backache, dry throat, dry hair and skin, brittle nails, dry vagina, night sweating, dry stool, scanty menses or amenorrhea, 5-palm heat, feeling of heat in the evening, red tongue, without coating, floating empty and rapid pulse. Liver qi stagnation that causes feeling of distension of the eyes when tense will be associated with frontal headache, hypochondrial or epigastric distension, irritability, moodiness, a feeling of the lump in the throat, premenstrual tension, and a wiry pulse. And finally, for damp heat in the liver and gallbladder that causes feeling of distension of the eyes, you will also note swollen red eyelids, fullness and or pain of the hypochondrium, abdomen, or epigastrium, bitter taste, poor appetite, nausea, feeling of heaviness of the body, yellow vaginal discharge, vaginal itching, mid-cycle bleeding and or pain, burning on urination, dark urine, yellow complexion and eyes, vomiting, red tongue with redder sides and unilateral or bilateral sticky yellow coating, wiry, slippery to rapid pulse. Thank you so much for your attention.
Now we will talk about the energetic properties of food. Cereals. Most cultures' diet is cereal-based. This is also in accordance with Chinese medicine dietetic theories in which cereals such as rice, millet, and corn should constitute the greatest portion of food that is consumed. Most grains are relatively neutral in their temperature and generally strengthen qi and shui. This means that regularly consuming relatively large amounts of them will generally not create imbalances in the body. Most cereals also have slight damp draining qualities, but unfortunately not all. Modern wheat is particularly problematic. This is because, as well as having a cooling energy, wheat has also been modified to produce a higher yield and to suit the needs of the baking industry. This has resulted in wheat having a tendency to produce dampness in the body. This is particularly problematical given how many people's diet is based on the consumption of bread, pasta, and other wheat-based foods. Barley is salty, sweet, slightly cooling, drains dampness and heat, and nourishes yin. Maize or corn is sweet and neutral and strengthens qi and blood. Millet, sweet, salty, and neutral. Some sources classify millet as being either slightly warming or slightly cooling, strengthens the kidney and spleen qi, transform dampness and phlegm. Oats, sweet, neutral, and warm, strengthens qi and nourishes blood. Quinoa, sweet, salty, and slightly warm, strengthens kidney yang. Rice, neutral and sweet, strengthens qi and blood, harmonizes the stomach, and strengthens the spleen. Rye, bitter and neutral, slightly cooling, drains dampness. Spelt, sweet and neutral, slightly cooling, strengthens qi and nourishes blood, less dampness and phlegm creating than modern wheat. Wheat, sweet, cool, or slightly cold, drains heat, nourishes the qi, and nourishes blood, has a tendency to create dampness and phlegm. Dairy products, generally sweet and cool or neutral, This is goat and sheep milk is neutral or slightly warming, which makes it a better option for people who are spleen Qi deficient. Dairy products are very rich in flavor and therefore can have a tendency to create dampness. Fish. Freshwater fish are usually sweet and salty in their flavor, whilst being neutral or slightly warm in their temperature. Saltwater fish usually have a salty flavor and a cool temperature. Trout is slightly hot and salmon is warm. A lot of shellfish are warming. Fruit, generally sweet, sour, and sometimes bitter. Most fruit is cooling and in its thermal dynamic. Exceptions to this are apricot, raspberry, and cherry, which are slightly warming. Tropical fruit is generally cold and should preferably be eaten in warm Yang climates, not in the autumn and winter in Northern Europe. The sweet and sour taste helps to create fluids, but the sour taste will bind the fluids in the body, which is not good when there is dampness. Meat. Meat is generally warm. Meat is good at tonifying yang, qi, and blood. Because meat is very rich in flavors, it can be difficult to transform and it can lead to the creation of phlegm and heat. The various kinds of organ meats, such as kidney, liver, and so on, will tonify the corresponding Zhangfu organ in the body. It is, however, highly recommended that the liver and kidney are organic due to the use of growth promoters, antibiotics, medicine, and other chemicals used in the production of meat. Beef. It is sweet and neutral or slightly warm. Chicken is sweet and warm. Duck, sweet, salty, and neutral or slightly cooling, nourishes yin and blood. Lamb is sweet and hot. It strengthens qi and yang, nourishes blood, can aggravate heat and fire conditions. Pork, this is sweet, salty, and neutral or slightly cooling. It nourishes yin and blood, tendency to create dampness and phlegm. Thank you for listening.
We discuss Yangming heat, diagnosis according to Sanjiao theory. Yangming heat, the pathogenic heat is directly invaded or penetrated down to the stomach, which will correspond to the Yangming stage and Qi level, stomach and large intestine heat. Etiology, exposure to pathogenic heat. Symptoms and signs, constipation or green watery diarrhea. This is false diarrhea caused by blockage of compacted feces in the intestines. Abdominal bloating and distension that feels worse when palpated. Fever, especially late in the afternoon, but no aversion to cold. Profuse sweating, mental confusion, restlessness, frontal headache, bleeding gums, red face, red tongue with a dry yellow coating, rapid, full, and flooding pulse. Key symptoms: constipation, bloated abdomen, fever, rapid and flooding pulse. Treatment principle is to drain heat from the stomach and large intestine. We can choose from LI11, Sanjiao 6, stomach 25, stomach 34, 37, 44, bladder 21, bladder 25, and DO 14. Needle technique is draining, and DO 14 can be bled. LI11, Sanjiao 6, stomach 25, 37, and bladder 25. Drain heat from the stomach and large intestine and move qi in the intestines. Stomach 34, 44, and bladder 21. Drain heat from the stomach. DO 14 drains qi level heat. The patient should eat foods that are cooling and moistening in their dynamic. They should avoid foods and beverages that have a hot energy. Boiled or steamed spinach and cabbage will be beneficial, as well as sauerkraut. Yangming heat can be caused by no previous pattern at all or upper jiao heat. Yangming heat can result in lower jiao heat. Thank you so much for listening.
Zhang Vicera, the lung physiological functions. Confluence of all vessels assisting heart to circulate blood. Confluence of all the vessels has two aspects. On one hand, the vessels converge as they flow into the lung. On the other hand, several of them link the lung and the heart together structurally. The physiological significance is that the blood from the entire body flows into the lung, where by means of the lung's respiratory function, it engages in gas exchange. It then flows back to the entire body. The plain question states, the lung is like a ministerial official With it comes functional coordination. This metaphorically compares the lung to the premier of a state and the heart to the king. The lung controls chi of the entire body and regulates respiration. Since the circulation of blood depends upon the motive force from chi, the lung assists the heart to drive blood circulation. For example, in chronic cough caused by lung chi deficiency, deficient chi is unable to push the blood to flow properly. This chi deficiency can lead to stasis of blood, giving rise to such symptoms as a forceless cough, dyspnea, a tightness in the chest, palpitation of the heart, and cyanotic lips and tongue. It can be seen that blood circulation results from the cooperation of the heart and the lung. Heart chi provides the motive force for the flow, and lung chi provides assistance. Dispersion, depuration, and clogging water pathways. Dispersion, one of the lung's main physiological functions, has three aspects. It disperses and distributes defensive chi to the surface of the body, where it can carry out its warming and protective actions. It distributes chi, blood, and body fluids to the entire body, where they nourish and moisten all organs and tissues. It disperses and expels from the body the stale air produced by metabolism in order to complete gas exchange, and it discharges fluids through the sweat pores. Depuration means purifying and descending. This function also has three aspects. The lung inhales fresh air from the natural environment and conveys it downward to the kidney so as to maintain deep, even, and smooth breathing. After the essential substances of drink and food have been transformed by the spleen, the lung distributes them throughout the body. In this way, it has an important role in the metabolism of fluids and in the maintenance of the proper balance of metabolism. The lung also eliminates the pathogenic poisons, keeps the respiratory tract clear, and assists the large intestine in the excretion of wastes. The unclogging function of the lung enables it to carry out its dispersing and purifying functions. The excretion of an appropriate amount of sweat helps regulate water balance and metabolism. When chi moves, so does water. When lung chi moves downward, fluids also move downward to reach the kidney, where they are converted into urine. The urine is stored in the urinary bladder to await excretion. These functions are the basis for the sayings, the lung regulates the passage of the water, and the lung is the upper source of water. The two main functions of the lung, dispersion and depuration, complement each other. Under physiological conditions, they act to maintain normal respiration. Under pathological conditions, they also affect each other. Without normal dispersion, there cannot be normal depuration, and without normal depuration, there cannot be normal dispersion. If these two functions are unbalanced, there may be tightness in the chest, cough, dyspnea, edema, and phlegm retention. Thank you for your attention.
Let's discuss heart imbalances pathology, still under diagnosis according to Zheng organ patterns. When the heart is imbalanced, this can manifest with changes in both its physical functions, such as heartbeat, and how the Shen is manifesting. The heart is the most yang organ in the body, and the Shen is the most yang aspect of the body's qi. This means that the heart, and in particular the Shen, are very sensitive to pathogenic heat due to its yang nature. On the physical level, heat will overactivate the heart, causing it to beat faster. This can manifest with palpitations and a rapid pulse. It is perhaps important to point out here that palpitations in Chinese medicine means the subjective sensation that the physical heart is beating stronger and faster than normal. If the heart is in balance, you are not aware of the heartbeat. It is not something you actually feel. Palpitations in Chinese medicine encompasses everything from being aware that the heartbeat is slightly more pronounced and is noticeable on the one hand to outright disorders such as atrial fibrillation on the other. It is important to be conscious of this when interviewing a client because many patients have a sensation of their heartbeat sometimes being slightly stronger without them thinking of this as being palpitations. This is nevertheless an indication that there is a heart imbalance in Chinese medicine, and it is an important sign. Cold can also affect the heart. The heart as an organ cannot be directly invaded by exogenous cold. Exogenous cold can, however, stagnate heart blood, and cold can therefore be a factor when there are heart blood stagnation patterns. Yang deficiency conditions can also result in the heart not performing its functions optimally. Like most heart imbalances, heart-yang deficiency can manifest with palpitations, where palpitations in heat imbalances are the result of the heart chi being agitated and overactivated. Palpitations that are due to heart-yang deficiency will be the result of heart-yang losing control of the rhythmical pumping action of the heart. This is the same mechanism that results in palpitations when there is heart chi deficiency. Heart blood and heart yin should anchor the heart yang aspects, which include heart yang, qi, and shen. If there is heart yin deficiency or heart blood deficiency, they will not be able to anchor these yang aspects. This can again result in palpitations due to the heart no longer being able to control its rhythmic pumping, but this time there will also be a slight emotional unrest or anxiety that manifests concurrently with the palpitations due to the shen not being anchored. If there is a significant disruption of the physical functioning of the heart, such as when there is heart blood stagnation, there will not only be disruption of the rhythm and strength of the heartbeat, but there will also be cardiac pain or pain in the thoracic region. The pain will be a fixed stabbing or piercing pain. If there is chi stagnation, there will not be the same sensation of pain, but more of a sensation of chest oppression and tightness. It will feel as if there is an iron rim or a strong elastic stretched around the chest. Phlegm stagnation will manifest with a similar but different sensation. There will again be chest oppression, but phlegm will manifest with a heavy black sensation in the chest as if there is a great weight, such as a rock lying on top of the thorax. Because the heart and the lung have a very close relationship, a disturbance of the heart chi will also manifest with the breathing being affected. Similarly, Zhong Qi helps to drive blood through the vessels. If there is dysfunction in the heart or if Zhong Qi is weak or stagnated, blood will not reach out to the extremities. This can manifest in white, cold fingers and toes. This is typically seen when there is heart Qi deficiency and heart Yang deficiency. Purple fingernails are seen in conditions where there is blood stagnation, including heart blood stagnation. Shen encompasses the Western concepts of the mind and consciousness. When there are heart imbalances, they will nearly always manifest with changes in the person's Shen, which can be anything from almost unperceivable, subtle changes to severe personality disorders. Shen is nourished and anchored by heart yin and heart blood. If these are weak, Shen will lack nourishment and rooting. The person will be easily startled and unsettled due to their Shen lacking stability. Often, the lack of anchoring will also cause the person to have difficulty sleeping or be nervous, uneasy, and restless. This will be more extreme if there is heat due to yin deficiency. The agitation and restlessness will not only be mental, but it will also manifest physically with the person fidgeting and having nervous movements, especially when they are uneasy. Shen is, in general, very sensitive to heat. Excess heat, in particular, agitates the Shen. When the Shen is agitated, the person will be mentally restless and feel uneasy. Their Shen becomes too active. The difference between deficient and excess heat will often be seen in the intensity and severity of these manifestations. If there is excess heat, the person will seem to be more stressed, their mental unrest will be more pronounced, and they will be more irritable. If the heat is intense, there will not only be mental unrest, but also actual mania. Thank you so much for listening.
Qi and body fluids, blood and body fluids, its relationship. Actions of qi on body fluids. The action of qi on body fluids are quite similar to those of qi on blood. Promoting fluid production. The movement of qi provides the generative power for the production of fluids. Body fluids derive from essential qi of drink and food transformed by the spleen and the stomach. Their formation and distribution are closely related to the spleen, the stomach, and the small intestines. If qi of the involved Zhang viscera is plentiful, body fluids will be plentiful. Conversely, they will be insufficient. Powering fluid movement. The distribution and excretion of body fluids depend on qi movements of ascending, descending, exiting, and entering. The metabolism and distribution of body fluids and the excretion of sweat and urine are all depend upon the coordinated actions of the lung, the spleen, the kidney, and the organs. If qi moves so body fluids, if the ascending, descending, entering, or exiting of qi is impeded, then the distribution or excretion of fluids is also disturbed. This may lead to water retention, phlegm accumulation, or dampness obstruction that can result from the stagnation of water. Stabilizing fluid movement. Qi regulates and controls the movement and excretion of fluids and prevents their excessive loss. For example, defensive qi controls the opening and closing of pores and helps to prevent damage to body fluids from excessive sweating. Kidney qi causes the fluid stored in the bladder to be transformed by metabolism into urine and its discharge. Deficiency of qi can lead to spontaneous sweating. Deficiency of kidney qi can lead to frequent urination, polyuria, and enuresis, and incontinence of urine. Actions of body fluids on qi. Like blood, body fluids are a carrier for qi, and qi must be attached to fluid or blood to act. If body fluids are depleted, for example, by diaphoresis, polyuria, vomiting, or diarrhea, qi loses this attachment and may scatter. This gives rise to qi collapse following heavy loss of body fluid. The relationship between blood and body fluid. Both blood and body fluid belong to yin, and both act to nourish and moisten. They supplement each other in physiology and affect each other in pathology. Since they both derive from the essence of drink and food, body fluid and blood share the same source. When infused into a blood vessel, body fluid becomes a component of blood. Some components of blood may also seep out of the vessels and become part of the body fluids. Under abnormal conditions, when there is massive loss of blood, body fluid enters the vessels to make up for the volume of blood. This in turn leads to insufficiency of body fluid and such symptoms as thirst, oliguria, and dehydrated skin. Conversely, if there is a massive loss of blood fluid, some components of blood can come out of the vessel, resulting in insufficiency of blood. The internal classic states, those who have lost much blood do not sweat. Those who have sweated profusely lack blood. This is the practical application in clinical practice of the theory that body fluid and blood share the same source. Thank you for your attention.
Let's continue our discussion on dizziness with the pattern qi and blood deficiency. Qi and blood deficiency has the following clinical manifestations. Like dizziness, sometimes only on change of posture, tiredness, dull, pale face, poor memory, insomnia, palpitations, depression, poor appetite. The tongue is pale and thin, and the pulse is choppy or fine. This is essentially a deficiency of spleen and heart blood. This is usually a cause of mild dizziness in younger patients and more in women. The treatment principle, we tonify qi and nourish blood, strengthen stomach and spleen. The points to choose from are stomach 36, spleen 6, Ren 12, bladder 20, bladder 21, do 20, Ren 6, and bladder 15. With reinforcing method, and moxa should also be used. Stomach 36, spleen 6, Ren 12, bladder 20, and bladder 21 strengthen the stomach and spleen and nourish blood. Do 20 facilitates the rising of clear qi to the head and relieves dizziness. Ren 6 tonifies qi in general, and bladder 15 nourishes heart blood. Thank you for listening.